My name is Isioma Okolo. I'm a consultant obstetrician gynecologist and a recent trustee with Amma. My experience as a trustee with Amma is at the moment quite limited, but I've got quite extensive experience of being on previous boards, so also in Scotland with an organization called KWISA. And I've served on that board for at least the last 7 years. I'd say what was most surprising was the amount of behind the scenes work. And I guess it was quite humbling, I think, especially for somebody who doesn't have third sector experience, all the work it takes to make these organizations run effectively, especially from a point of view of governance. So it's quite humbling. And I think it gives you a sense of humility when you interact with other third sector organizations and charities. Do you recognize how difficult it is for third sector organizations to fundraise? And you recognize the challenges when it comes to getting funds, but also when it comes to applying for funds over and over again. So there's a challenge with sustainability. So there's a lot of good work that goes on in third sector that the private sector and public sector cannot replicate, but the challenge is scaling it up. So this is what we struggle with in third sectors. Organizations can give back in kind with regards to hours of volunteering, or if you have a specialist skill, and certainly like partnering with an organization to raise funds is a brilliant way, because it is extremely challenging raising funds, and the funds are not infinite, and it comes with the challenge of having to apply over and over again. And what you find, especially with medium-sized organizations like Amma and small organizations like KWISA, is that is even more challenging. So I think if you can do anything to help with regards to your time and organizations that can partner, that's a brilliant thing to do. I think it's important because for me, it was a way of connecting the dots. So I'm a clinician and specifically a hospitalist. So I'm often based in an acute setting, but we know that when it comes to health, health is not made in the clinics, in the operating rooms, on our labor wards. Health is made in the community. So I think if you're anybody who's interested in promoting positive health, you have to have some interest in what goes on in communities, which is why organizations like Amma are particularly critical. Obviously, I'm biased because I'm an obstetrician, so the work Amma does is very relevant to me, particularly around addressing inequalities with regards to access and experience. So Amma do a lot of work with regards to service provision, education, and more recently, advocacy as well. So I think it's very important because as if you are in one sector, it gives you a better understanding of other aspects of that work. It's a way of giving back, in terms of paying back to your community. It's a great opportunity to boost your leadership skills, also a really good opportunity to network as well. In all my experience as a board member with various organizations, I've always worked with the organization first, either in a voluntary capacity or as a consultant on some issue. So for me, that's very important. I think it's important to know the organization before you serve as a trustee, because I guess you're more motivated to do good work as a trustee. So with Amma specifically, I'd worked with them with regards to advising them of the recent report, their birth outcomes report, which has been very significant and impactful in Scotland with regards to, I guess, showcasing the impact and disparities for minoritized women in Scotland. So women who are minoritized by their race and ethnicity, by their immigration status, by their socioeconomic status. This is where Amma is really sat strongly to have their voices heard, but also to provide that companionship in hospital settings when women and birthing people can feel very vulnerable. So Amma's work in that space was really inspirational. There is not another organization in Scotland that does the work to this extent. I wish we had Amma all over Scotland because we desperately need it. And I think many of my colleagues, midwives, nurses, doctors, value the work Amma does because we don't have that capacity to do the work in the hospital setting. Like we all know, there's so many NHS gaps. So I have a lot of respect for the work and the role Amma is filling in the hospital system. So my first trustee role ever was with an organization which I'm still a trustee with called KWISA, Women of African Descent in Scotland. And this is an organization that was set up really to focus around challenging issues with gender-based violence and basically forming communities within Scotland of women of African and Caribbean descent. Strong focus on female genital mutilation. So a lot of the work KWISA does is around advocacy and policy change, as well as networking. So, and again, I think looking back, I still work with KWISA, looking back, what I would have done differently when I first joined, because I joined as a volunteer, very similar to Amma, in that I was helping with, I guess, education with regards to women's health, creating content, particularly during the pandemic, to help with like digital literacy and reproductive well-being. Looking back, when I became a trustee, I learned on the job, which is really good. I had great mentorship from the founders of KWISA and the other board members. And eventually, over the course of time, I've now received formal training. But I would have liked to receive formal training at the very beginning. So thinking to my future and to people who are thinking of becoming trustees, and if I were to set up an organization, I would say with every new trustee you, I guess, recruit, at the very beginning, within the first 6 months of their trusteeship, get them formal training, regardless of their experience, because we can all learn from some formal training, and then also in that capacity, buddy them with an existing trustee member that can kind of help them with regards to any blind spots in their trustee capacity, whether it's around fundraising, partnership forming, advocacy, that kind of thing. So that's why I do differently. I do the training at the very beginning. My piece of advice, if you're considering the first trustee role, is to go for it. Do your homework, though, and find out specifically more about the organization. So being a volunteer before is really good. Find out about the time commitment required, because there's a lot of work that goes behind the scenes. And yeah, absolutely go for it, but just make sure that it fits in with what you have to offer and what you can also benefit from it as well. So I've gotten, I would say, a big network of friends, some people who I now consider family. And it's really challenged my leadership skills in a very positive way. The organizations I've been trustees with have always had an advocacy slant, and that is very much in line with what I do. I am very much a community advocate and community developer, so they've helped boost my advocacy skills and confidence in that way. The network you gain as well, especially, it's good you're catching me on video now, but usually I'm in scrubs, catching babies and ovaries. So this is not normal for me. So it's really good, because then it means that I think it contributes towards my work-life balance as well. We're under significant strain in the NHS just now, and it can be very difficult for people to see, I guess, positivity in the horizon. But working with community groups where health is made is a really good way to address, I think, the moral injury that we're experiencing in the NHS just now. And also, it's good fun, really good fun.